the thoracic and spinal region. So first we're going to find the occiput bone, which is right up here. And then if we go laterally, we can find the nuchal lines right here, and they run off the opposite here. And then we are going to have you round your back, and we're going to find the most prominent spinal vertebrae. That's the C7. So from there we would go up, and we would go, okay, C7, C6, C5, C4, C3, and then C2 and C1 are here, but they're a little harder to find because they're in the atlas of the head and the axle of the head, so a little harder to palpate. Next, we are going to find the hyaloid bone. So if I can have you face the camera. So hyaloid bone, if you go down laterally from the jaw right here, this is the hyaloid bone. And then I'll have you turn around again and round your spine again. So once again, we're going to find the most prominent spinal vertebrae, and then from there we're going to go C7, T1, T2, T3, T4, T5, T6, T7, T8, T9, T10, T11, and T12 right there. Then we are going to have you move your shoulders back, and we're going to find the sternum angles. So if we go down right here, we go down laterally and move across. These are the rib angles right here. And then I'll have you turn around, face the camera again. And these are the three parts of the sternum. So first we're going to find the mastoid, and then we're going to find the xiphoid bone, which is down here. And this probably makes up most of the part of the sternum. Next, we're going to find the sternocleidomastoid. So if I can have you, it's right along here. If he turns his head to your right, you can actually see it a lot better right here, and it helps with flexion and movement within. Next, we are going to find the spinous capitis, which if you follow down below the ears, right along here, we have the spinous capitis, and then the sphenius cervicis is right along here. It's a little harder to palpate because it's more superior, but it's right along here. And then we're going to find the three erector spinalis muscles. So the first one is the longissimus, and it's the longest and the most thickest and closest to a spine muscle. It goes up along here, and then it goes back into the head. Next, we have the iliocostal, which runs along the iliac crest, which also goes up along and into the ribs, and then it also goes into the head. And finally, we have the iliac crest. We have the quadriceps lumbar, which goes up and just into the ribs. Okay, so first we are going to palpate the rectus abdominis, which goes right up along here, and it also goes into the sternum. Then we are going to palpate the external obliques, which run right alongside of it. The external obliques help with rotation when you're doing exercises such as Russian twists. And finally, we were going to find the internal obliques, which is like putting your hands in a pocket, and they run right along here, and they also help with side rotation.